Welcome to the Health and Wellness Show. This is Paul Hamilton. Today we're going to be talking about headaches, neck pain, and stress. We're going to do this from the perspective of a chiropractic doctor. Today I have Dr. Ed Lubberdink with me. Welcome to the show.
Thanks, Paul. Glad for having me.
Before we get started, I'm always interested to know a little bit about why somebody chose to get into their profession. Could you tell us how and why you decided to become a chiropractor?
Sure, absolutely. You know, it's interesting. Everyone has their own story, and I'm often always curious when I'm talking to chiropractic students what their introduction was. But mine was, I actually wound up hurting my back, and I knew my parents had been going to see a chiropractor for years, but really didn't know anything about it. And I hurt my back working the summers actually as a garbage man. And I didn't want to lose that job for future summers because the pay was so great while studying at university. So I went to see my family doctor, and he put me on a medication. And about a week later, it wasn't getting any better. So then he changed medications, and 2 weeks later, still wasn't any better. So my parents said, "Enough of this. We're going to take you down to see a chiropractor they've been seeing for quite some time." Took me down to see this guy. He's a great guy, and really took an interest in not only my back, but me as a person, and asked me what I was doing with my life, and I said, well, I'm really not sure. It's either I'm going to be a pilot or go into forestry. And he said, well, why would you want to do those things when you could become a chiropractor? And I started laughing, and I said, you know, I don't really know that much about chiropractic after my parents go and see you. And he said, well, why don't you come down and I'll book you in as a last patient, and we'll go have lunch together. So he took me out for lunch, and he brought me back to the office, and he didn't have any patients that afternoon. It was his off afternoon. And he showed me some interesting x-rays and told me a little bit about the philosophy of chiropractic, and I was intrigued. And, you know, I went back home, and I said to my parents, I said, you know what, I think I'm going to become a chiropractor. And they said, great, you know, and that was sort of the start of it all.
Wow, that's a terrific story about how you got introduced. And hopefully, you know, you're spreading the word, too, about your type of treatment that you provide to some of your patients.
Well, yeah, you know, it's always interesting because I do spend a lot of time with, you know, when I find some, you know, high schoolers that are approaching sort of what they are thinking about doing as far as the future is concerned, and a lot of them sort of don't know at that age, and I start planting seeds because one of my goals is to, you know, have patients of mine that came to see me as kids actually go into the profession, and it's happened once, and I'd like to repeat that as often as I can.
Terrific. You must feel good about that, and you're helping to pay it forward, so to speak, in the sense that your original chiropractor that you went to, how he got you into your field.
Absolutely, absolutely. You know, it's interesting. I always think the best practitioners are the one that come from a story like mine, that have had a personal experience. Because, you know, some people get into healthcare professions for a variety of reasons, but sometimes it's strictly economical, you know, and let's face it, those people sometimes don't make the best practitioners. You know, I think people that come from a place of the heart often are the ones that seem to have the best empathy and actually the best bedside manner, and become, in my opinion, the best healers. You know, so yeah.
I agree. And you have a personal experience with it, and you have a real passion, it sounds like, for helping people truly with the root cause of what their problems are.
Absolutely, yeah. Mm-hmm.
Now, there are some misconceptions or myths about what much of the public thinks about chiropractic treatment. What are some of those misconceptions?
Well, you know, the ones that come up to mind initially are that it hurts is probably the number one, and that it's expensive would be number two, and number three, that once you go, you got to keep going for the rest of your life. So if I can sort of dissect each one of those and just help the public in that area. First of all, when it hurts, I mean, I don't know where that's coming from. I think that's not really coming from patients telling patients, because if it was patients telling patients, then patients would tell them that it doesn't hurt. So it's interesting, after I adjust a patient for the first time, I can also always sense some apprehension on their behalf. So when I do the first adjustment, I say, there, that's it. Did that hurt? And they go, no. And I say, well, that's it. And then you can see them just sort of breathe, relax, their shoulders drop, and say, okay, that's fine then, you know. And it's sort of like the old days of when you first had a root canal. I mean, they were pretty painful. And now it's to the point where, you know, the technology is so great that root canals are really not a big deal anymore. So patients relax after the first adjustment, and then they realize from that point forward it doesn't hurt. The only time it can hurt occasionally is if the patient's in acute pain, and there's a lot of muscle tightening, and so when you're doing an adjustment, sometimes it can strain the muscle a little bit. For the most part, though, it is painless. I guess the second one is finances. People tend to think it's really expensive. And nowadays we have what's called treatment plans where we make it more affordable for patients by just taking their cost factor down by we can do certain plans. Like in our office, for instance, if we know it's going to take, for instance, 3 months to correct a problem, then and we typically see the patient more often in the first month and decrease in the second month and decrease in the third month, then we'd sometimes take that entire cost and divide it by 3 equal payments, so to make it a little easier for a patient to understand, And if they get better sooner, then obviously we credit them the difference, And I guess third would be once you go, you got to go for the rest of your life. And what happens is we find that the stresses of what we do for a living, whether it's, in my case, bending over patients all day long, other people it's sitting at a computer all day long, whatever it is, those stresses will cause misalignments to reoccur often. And the intent there is that you maintain your spine just like you maintain your teeth or you maintain your body, you maintain your car. So the intent there is, you only have to go as long as you want to go, but does it make sense to go on a maintenance care basis? Absolutely, because it's something that you can do to maintain versus just treat. So in other words, in our office is what I call a true wellness clinic. 85% of the patients that we see every day in our office are patients that are not in pain, but have been in pain at one point in their life and now wish to remain not in pain in the future. So by doing some periodic checkups, we can keep them pain-free and healthy. And so it's a standpoint is obviously the patient always can choose how long they wish to go, but is it something that is worth doing? Absolutely. It's just like going to the gym, eating properly, getting good sleep. All these are all things to maintain your health. So hopefully that answers that question for you.
Yeah. So it sounds like mostly or often people come into your practice because they're in pain and they have a specific problem, but then once that's been addressed and they've been educated about how chiropractic treatment can help, then they continue on the wellness program because they recognize and they understand an ounce of prevention is worth a pound of cure, and they'd rather not get into that situation where they were in acute pain before.
Absolutely. It's all about choice. It's their choice. I mean, we do a lot of patient education in our office, and they ultimately have the choice of what type of care they wish to choose, whether they want to have just acute care, pain relief, correction of the problem, or correction and maintenance of the problem. So they always choose which care they want. So no one's forced to do anything they don't want to do. But again, 85% of our patients are people that want to maintain their health versus just patching it up.
Great. Now, what type of treatments and conditions do you treat in your practice then?
Well, a variety. I mean, most people present with orthopedic symptoms, the typical low back pain, neck pain, headaches, sometimes knee pain, that type of thing. However, there is every time that you are adjusting the spine, you're influencing what's called the autonomic nervous system, which means that those same nerves that come out of your spine don't just give nerve supply to the muscles, but they also give nerve supply to organs. So for instance, say if somebody comes in with mid-back pain and we do a detailed case history, sometimes we find people with mid-back pain will also maybe have digestive issues, upset stomachs, indigestion, gas, bloating, things like this. So while we're adjusting their mid-back and correcting their orthopedic symptoms, quite often their internal health will improve as well, because if you can increase nerve supply going to an organ, then that organ's going to function better. It's just like electricity going to a light bulb. The more electricity going to the light bulb, the greater it shines. Okay?
Mm-hmm.
Yeah.
So how does proper alignment contribute to many of the health challenges people deal with then?
Well, it's an entire host of issues. So poor posture is one that we're seeing a lot of these days. So many people sitting at computers for, up to 8 hours, 10 hours per day. And that puts a lot of stress on the nervous system itself, because when you have a poor posture, it strains the muscles, the ligaments, and you get a sort of situation, what we call It's like just postural deficit. It's just like, it's like trying to, if you sit at a computer for 8 hours, you're going to be uncomfortable. Simple as that. I mean, and this is why we encourage patients to get up, move around, do some stretching during the day if they're sitting at computers, just to prolong their ability to do the job that's required. I remember when I started in practice 32 years ago, we didn't have a computer in our office. We didn't have one computer in our office. Now we have a total of probably about 8 of them. So it's this technology has crept into everybody's lifestyle, including their homes. And what we notice is that, like children, that we used to see people with no loss of curvature in their neck, typically till they got to the age 30, 35, 40. Now we're seeing in teenagers already because the amount of time they're spending on computers. Texting. I mean, you see the amount of time that people spend texting as well. It's phenomenal. So, other issues that we see is, stress on weight-bearing joints such as the lower back, hips, and knees, early osteoarthritis. These things are all caused by improper alignment of the spine. And our goal is to not just sort of get somebody out of pain, but now is to help them with their health. Because again, I'm going to repeat this again, a true wellness clinic deals in keeping people healthy versus, say, the average walk-in clinic. People are going to because they're already in a situation of crisis. They're already having symptomatology. Their health has already failed them. Whereas a true wellness clinic, the idea is to prevent that situation from occurring in the first place.
So what about headaches? I imagine you see quite a few people with headaches. What would the cause be of headaches of most of the patients that you see with that condition?
Well, headaches are caused by a bunch of different things. Stress is a big one. Okay, people that are under a lot of stress, a headache is a very, very common reaction to stress. Because what happens is, and this is really interesting, is that the body produces symptoms when something is wrong. Okay, it's like when your oil light comes on your dashboard, it's for a reason. So when the body starts producing symptoms, it's there for a reason as well. Now, all too often, people, the first thing they do is reach for a medication to treat the symptom. But the medication doesn't treat the underlying cause of the symptom in a lot of cases. It merely treats the symptom, so the underlying cause is not addressed. And after a while, the body stops producing these symptoms to the patient sometimes because it just has been given this chemical all the time. So what we see is, as far as headaches, again, stress is a huge one. Post-whiplash, people that have had traumas to their neck or head. There's basically, I think, about 14 different types of headaches that are out there. There's 2 basic categories. The primary typically are what we call vascular origin. In other words, they have a blood supply issue, either too much blood supply going to the tissues, and those are typically I guess you would call them the cluster and migraine tension type headaches. And the secondary type of headaches are typically inflammation to the head and neck itself from exterior sources such as stress and trauma and things such as that.
Mm. And what about neck pain? Is that related in some way, or what would the cause be of that?
Well, neck pain, yeah. I mean, injuries to muscles and ligaments is a very common cause of neck pain. Poor posture, again, I keep going back to this poor posture, but computers and texting are just creating it's like a micro trauma. It's not something that'll hurt you initially, but over a period of time can create a problem. What we call subluxation, which are misalignment of vertebrae, often will cause neck pain as well. And interesting enough, a lot of people have neck pains. Headaches are often associated with the neck pains. So in other words, the two are very interrelated.
So it could be an acute situation where they have some sort of injury or some sort of sudden movement or in a car accident, or it could be just a long-term exposure to poor posture, such as sitting at the computer for many hours a day.
Oh, absolutely. We call those sort of like, there's the acute ones and then there's the chronic ones. The acute ones are typically the traumas, and the chronic ones are typically, from workplace or just poor posture.
Now, with your education and training, you must spend a lot of time learning how to properly assess x-rays. So I'm curious, what do you see in patients who have headaches and neck pain and those types of conditions?
There's certain things that we certainly look for on x-ray. And one of them is the primary is a loss of normal neck curvature. We find that when you look at somebody from the side, there should be about a 42-degree angle of the neck. Okay, it should be a nice normal curve. But so many people that we're x-raying now, when we're doing side view x-rays of the neck, have lost this normal curvature, a normal postural curve that's meant to hold up the head, which is on average about 16 pounds. And as a result of this, it puts a lot of stress on the lower vertebrae and sometimes the upper vertebrae as well. And so this is one thing we see a lot of. Other things that we will see on X-ray a lot of is degenerative disc disease as well, which is osteoarthritis, wear and tear. And that's often associated sometimes with people that have headaches as well, especially in the upper neck. And then what people also don't realize is that everyone thinks when you mention where's the brain, everyone puts their hand on top of their head, and that's true. But the brain stem, which we've heard of, I'm sure, in brainstem injuries, goes as low as the second cervical vertebrae, or C2. So if you sort of would touch the lower part of your earlobe and then push into your neck, well, that's as low as the brainstem goes. So misalignment of these upper two neck vertebrae are often involved with headaches as well. And when you start correcting those, it can make a huge difference in a person's life. I remember one case when I was x-raying this gentleman who came in with severe migraines, and I'd asked him in his history to tell me a little bit about them, and he said, let me tell you something. He says, they are so bad. He says, when they come in, I have to put myself in a dark room, often for up to 48 hours at a time. He says, and all I do is sleep and eat in this dark room. He says, they're horrible. He says, I have a very understanding boss. He says, or else I would have lost my job. And he says, on more than one occasion, I've considered committing suicide. And
Oh, my.
Yeah. I mean, that's how bad sometimes these migraines can get. I've never had one, so I can't tell you myself personally, but I've heard from other migraine sufferers that they can be very, very horrible. And this was a great case. This is a great case where we started adjusting his neck and relieving pressure, and gave him some dietary advice too, which is another important thing too, because all too often patients are just given medications for their migraines with no thought process going into what this person's putting in their mouth or what beverages they're drinking. So there's certain beverages and foods that will trigger migraines, and then when you remove these from a person's diet, it's incredible. So the combination of some dietary advice, some exercises, some adjustments on the neck actually cured this person of his migraine headaches, and this person was forever grateful. And it's one of those rewarding cases that you have when you really know that you made a difference, a real strong difference in a person's life, especially when they say something about I've thought about committing suicide on more than one occasion. I mean, that's serious. I mean, that's a serious situation. So these are the kind of cases that are truly rewarding.
You can't put a price on that, so the reward that you feel from helping that person, and obviously from the change, the dramatic change in that patient's life.
Absolutely.
How do you measure that,
Well, you don't, and it's not about ego. It's about, it's just about doing the right thing. It's just, you don't go on a pedestal then saying, oh, geez, I think I may have saved someone's life. It's just that good feeling that you get that increases that person's quality of life so dramatically that gives you a good feeling. And that's why I always say there's people in the profession that live to practice and people that practice for a living, and I'm proud to say that, I live to practice. I after 32 years, I still enjoy what I do dramatically, and I enjoy teaching too. That's one of the most important things I enjoy too. We have a big patient education system in our office, and all new patients are required to attend a half-hour PowerPoint presentation that we do after hours every Thursday night at 7:30, which we educate the patients about the nervous system, about what chiropractic has to do, and about what we call the 5 essentials of health. And if you give me just 1 second, I'd love to just go through them with you, because these are so important for patients to realize. One of those adequate rest, relaxation, and sleep. So many people are sleep deprived, and children included. And nothing bothers me more than when people say, oh, I don't want you to sneeze on me, I don't want you to catch the cold. And I always say to them, you know what, it's not exposure to an organism that makes people sick, because if that was all it was, then doctors wouldn't be surviving in the hospitals, because they're constantly talking and touching sick people. We have an internal immune system that will allow us to survive exposure to organisms, And this is why it bothers me when I hear on the radio some pharmacy that's giving flu shots saying now it's okay to touch things again, as if people are so stupid to think that all they have to do is touch something and they're going to get sick. I mean, your immune system determines. So we go back to are you getting your proper amount of sleep, because people that are sleep deprived often get sick. Simple as that. We need a certain amount of sleep in order to stay healthy every night. And when you shortchange that, and I know from my personal experience, when I've become sleep deprived a couple days in a row, I become very susceptible, and then wham, 3 or 4 days later, you got the sore throat coming. Go, oh, here I go. But
Now
I
you
know.
would that. Now you're in tune with what's going on, but the general public may not put one and one together and get that connection necessarily. Say, where did this cold come from? Well, it's because you've run yourself down.
Exactly. That's exactly it. The pharmaceutical industry would love you to believe that there's no involvement with that, and then they make a lot of money actually providing all these cold and flu medications when the population should be just educated that sleep is so important. And same with kids, with parents, both parents working. And often kids aren't getting to bed on time, and as a result, what happens is these kids are going to bed late. The parents are having to wake them up in the morning. And that's one thing I always tell my patients. If you have to wake your kids up in the morning, guess what? They're not getting enough sleep, And then these kids get sick, and the parents say, oh, yeah, they caught it from so-and-so at school. When the truth is it wasn't they caught it from somebody. Says these kids were so immune suppressed because they weren't getting proper sleep. Another one is nutrition, what's being put in your mouth. There's two types of food, foods that are good for you and foods that taste good. And a lot of people just base what they eat based upon the taste of the food rather than asking themselves, is this food actually good for you, And number 3 is proper exercise. Again, 2 out of 10 new patients that I do histories on will only do exercise on a regular basis, meaning 2 or 3 times a week. 8 out of 10 don't. All right. And number 4, we say, is positive mental attitude. The connection between the mind and the body is so strong. I mean, what you think about constantly affects your internal physiology. It's called quantum physics, and there's so much literature documentation now on the relationship between what you think and internal physiology. And we find that those patients that are constantly negative all the time aren't getting well, and those people that sometimes have some of the worst things we see on X-ray, but have a joy for life. They come in the office and they say things like, have you been outside today? It's a beautiful day. And they say, no, I haven't been, but I'm looking forward to it later. And you look at their X-rays, you think, man, these people are doing great. How can they be doing so great? Well, it's their attitude that pulls them along,
Mm-hmm.
Yeah, and then finally, number 5, which we deal with directly as chiropractors, is sound central nervous system, because your nervous system is the computer that runs your entire body. And if the nervous system is running smoothly and is free of interference, then the body's going to be as healthy as it possibly can be. We sort of link it to, in layman's terms, a metaphor. It's like the hard drive on your laptop is like the brain of your body and nervous system. So what happens when viruses attach to the laptop, your laptop still functions. It doesn't function nearly as well as if there's no viruses. And we say it's like correcting misalignments in the spine or subluxations. If we remove those, your body's going to function a lot better.
That's a great analogy. I love that one. I'm going to have to note that one down and come back to that. So now, overall, stress plays a big role here. And a number of those issues that you just mentioned, they contribute to stress. I was wondering if you could elaborate a little bit on how stress might play a role, either before or after someone has a headache or neck pain or that type of thing.
Well, yeah. Well, stress, what stress does for a lot of people is stress affects different people differently. Some people will get headache when they get stressed. Some people will get shortness of breath. Some people have a myriad of different symptoms, digestive issues under stress. Everybody will handle stress differently. But what stress actually does physiologically often is it tightens the muscles surrounding the neck and can decrease sometimes blood flow going to the neck muscles and upwards. And that will often trigger a headache. So headaches, like I said before, are often caused by something, and it's nice to find out what's causing the headaches and then eliminate the cause versus just treating the symptom itself. So if a person's under a lot of stress and is causing headaches for them, then we would want to give them some good stretching exercises, the application of heat or ice whenever the situations are necessary, and just changes in ergonomic workplace, for instance. So if you have someone sitting at the computer for 8 to 10 hours a day, well, let's find out if your setup is proper, because a lot of people's setup is too low. In other words, they're looking down, the neck is in flexion as opposed to looking up. So raising the monitor up somewhat makes a big difference. And we give all our patients that work at computers for long periods of time stretches that they actually take the the poster, and they put it on their wall, and then it's right beside the computer monitor. So they look up every once in a while and say, "Oh yeah, I haven't done my stretches. I better do my stretches." And movement is great. The body craves movement. It loves movement.
So now those are some general tips that you can follow that are very good for headaches and neck pain. Now I imagine you have a much more specific treatment that you do in your office.
Well, yeah.
For
Yeah, well, when a patient presents with headaches, I mean, the first thing you want to do is a history. You want to do a careful history to find out what the cause of headaches are, because some causes of headaches may be indeed something that we don't deal with directly, and then an outside referral is necessary. So if you suspect that somebody may be having, say, space-occupying lesion, then we want to refer them back to the family physician for an MRI or CT scan to make sure that that's not going on, okay? And that would sort of present with a different type of headache. But for most of it, it's history, then it's physical exam and x-rays, and if all those things combined show that there's misalignment in the neck, and then we start correcting the misalignments in the neck in combination with some stretching exercises and some other sort of tips. Again, are they getting enough sleep? There's another classic. People that don't get enough sleep often get headaches more than people that get enough sleep, So it always comes back to those 5 essentials. So we look at the diet, we look at their exercise programs, we look at what's going in their mouth, and we make sure that also that, we try to put them in that light of living in the attitude of gratitude, and just to focus on that a little bit. Is like I tell patients, they may come and say, "Oh, it's supposed to rain the next 2 days," and I say, "Well, you know what? You could be living in the Philippines." Like try to just explain to them that there's always people that we should be blessed to be living in this country, that we have, most of us have roofs over our head and 3 meals a day, and that we have to, I believe in the spiritual law that the universe will not give you anything more until you're already thankful for what you already have, and it's amazing how many people out there should be thankful but are still miserable until whatever, they get the big house, the big car, the big raise, whatever it may be that they think gives that should give them pleasure, but they'll find out when they get those things it doesn't really give them pleasure.
So it's a pretty comprehensive approach then. It involves an adjustment or a series of adjustments if needed, if there's misalignment, but all these other aspects that you talked about in terms of rest and nutrition and mind-body connection, all of those elements go into a comprehensive treatment plan for somebody with headaches or neck pain.
Yeah, it's often not just a singular cause, it's multi-causal. And so the answer is not singular, i.e. a pharmaceutical often,
Right.
If you want to get to the root of the cause of the problem versus just treating the symptoms. So yeah, it's often multi-causal. So you have to go into a detailed history to find out what's going on in that person's life. I mean, they may have issues with their children, their spouse, it could be relationship issues. I mean, there's so many things that can create, these headaches in the first place. And, we try to help the patient in any area we can. And just making them cognizant of the effect of those areas of their life and what they're doing with respect to their health, how that influences their actual health is a great thing. I mean, what does doctor mean? Doctor means teacher. I mean, so I think so much, one of the biggest things I get a joy from is making people aware of the things that they can do to actually help themselves versus just, on the answer to all your healthcare problems.
Mm-hmm. So now you've touched on it before. I was wondering if you could just give us a bit of a summary or a recap of how you might or how your treatment might help contribute to overall wellness.
Yeah, well, it's interesting because, like I said before, most people will present with orthopedic symptoms. Typically, the average person who comes to see a chiropractor has an orthopedic symptom. In other words, a back pain, a neck pain, a headache, whatever it may be. And so, I mean, our goal is to, help them with their pain reduction because that's really what they came in for, number one. But number two is to educate them as to what they can do in their own life, as I just alluded to, what they can do in their own life to help in that department. But one thing that's really, really interesting as well is autonomic enhancement. Their internal health often will improve with decreased neurological stress through adjustments. And number three is like what we find then, whether some of the outcomes are like increased productivity in the workplace, decreased absenteeism. I mean, it's those things are really, really wonderful for people. So it's, when people come in, it's education, it's pain reduction, it's education, and then things they can do to prevent the problem from ever reoccurring. Because I always believe the highest calling of any doctor is to prevent what he or she treats in the first place.
Mm-hmm.
Yep.
So now, if If someone were looking to find out more about headaches and neck pain, proper alignment, the total health package that you just talked about, what are a couple of important tips that you might be able to pass on to people?
Well, I guess it's look for alternatives other than just pharmaceuticals. Look, I mean, there's a myriad of healthcare practitioners out there that deal with this. I mean, we have massage therapists who work in our clinic as well that do a great job with patients also that have headaches. Naturopaths are wonderful as well. They really do a good insight into a person's diet to see what happens. But when people are looking to visit a chiropractor, I think things they should look for is look for someone who, as I mentioned earlier, loves to practice versus practices for a living. And I think experience is a good thing as well. Look for somebody maybe who has some experience. Now, experience doesn't have to mean 30 plus years of practice, but somebody might have some experience in that particular area. And then another thing I think is very important is to find a practitioner, and this is any practitioner, whether it's your family doctor, whether it's a massage therapist, whether it's a chiropractor, is somebody who's actually empathetic, somebody who actually cares. And then another good thing I think is somebody who's got great listening skills, because I mean it's very, very important to listen to what your patients are saying. My dad used to say, God gave us 2 ears and 1 mouth, so we should listen twice as often as we speak. So I think that's a good thing. Although, if you were to listen to this interview now, I think I'm doing the opposite. I think I'm talking way more than I'm listening.
Well, the purpose here is to help other people, help you to educate people, because obviously you have a tremendous amount of experience and training and expertise and firsthand experience in all of these issues we've just talked about with headaches and neck pain and total overall balance. So you're out educating and giving to us right now. So we all appreciate that.
Well, thank you.
If listeners wanted to get in touch with you, what's the best way they can do that?
Well, one thing they can do is they can call our office, and our office phone number is 416-221-7724. And another thing I encourage people to do, email me, because I answer all my emails personally. It doesn't just go to our front desk and get filtered through finally to me. I answer them directly myself. And my email address is basically my name, Ed Lubberdink, which is EDLUBBERDINK @Rogers.com. Another thing we do in our office, too, if people want to find a little bit more, we give them an office tour. Anytime someone wants to just pop in, one of our staff will give them an office tour and just let them see our facilities. And if I'm available, I can just speak with them for a minute. But the most important thing, I think, is to come in on a Thursday night at 7:30 to our office. We start 7:30 sharp every Thursday, and we have what's called a doctor's report, which is a half-hour PowerPoint presentation that I was alluding to earlier. That we do every Thursday night that educates patients on what we call the 5 essentials of health. And that's a great way to understand what we have to offer, and then whether that suits what their desires are. Because, some people just want the quick fix, and some people, want to get better. So it gives them an understanding of what we're all about when they can meet and greet with our staff.
So they can either call you or email you to find out the details about where it's located. Or
absolutely. We've been in the same location for 32 years, which is kind of unique. Most people move around a few times in their practice time, but I'm still in the same place I was when I graduated 32 years ago. So it's kind of unique, kind of fun, yeah.
You're probably quite well known in your local area.
Well, I'm a legend in my own mind.
That's funny. Well, I'd like to thank you very much for your time on the show and providing us with a great amount of insights and information and the passion behind what you're talking about. You can really tell that you have empathy and you have great concern for the well-being of your patients, not just in terms of getting out of pain, whatever their particular problem is, but also in terms of helping them to have a healthy, lifestyle.
Well, thanks, Paul, and I appreciate you having me. I appreciate any time you have a chance to educate the public. I'm all for that. So thank you very much.
Okay, our pleasure. Bye-bye.
Bye.